All right. Well, welcome, folks. I know there are some block grant reviews going on today, I believe. So we may have a little bit lower attendance, but we have a great lineup today. So let's go ahead and get started. As usual, housekeeping. If you have any issues, please contact Jess Cohen, jcohen@amchip.org. If you have any questions that you'd like to pose for the panelists or anyone at AMCHP really, please try to make sure to switch it to your in the chat box to all panelists and attendees so everyone can see the question. Of course, if it's just something like a technical difficulty, you can feel free to send it to just to the all panelists. And a reminder, today's call will be recorded. Our agenda today, I'm going to give you a very, very short legislative update. We have some partners from MCHP and CDC who will share their updates, and then we can go into Q&A. So the legislative update, and I think this is actually the wrong one, so oops. Pardon me while okay. There were just a few extra, I think these are the wrong slides. Sorry, I'm checking with those. This is correct, but let me make sure that we have the right slides on before we continue. The update on COVID relief is that as of this week, the Senate was trying to pass another, a few like more business and paycheck protection related provisions, but it didn't move forward. And the prospects for passing a deal before the election are just getting slimmer. I mean, a lot of it, as we've been saying all along, is political. There was rumors that on a call with Senate Republicans, Senator McConnell said to the White House, don't cut a deal with the House Democrats. We need to focus on the Supreme Court confirmation and, you know, making it seem like a win for anybody before the election, which is in such a short time. So I don't think we're going to see anything before November 3rd. And then, of course, that will change the state of play for COVID relief package regardless. They could surprise us, but it's just looking like there's roadblocks coming from all different directions despite different indications. I'm gonna make sure that, yeah, for some reason this is missing slides, so I'm gonna pull them up. I'm so sorry for the technical difficulty, everyone. Give me, you know what I'm gonna do? I'm gonna actually have the CDC present first before MCHP so that I can fix and get the MCHP slides up. Is that okay? Do we have Dr. Remley? I see that you're on. Can I ask you to step in now and do your update while we fix the slides?
There we go. Can you hear me now?
Yes, thank you so much.
I'm sorry I'm a masked person today, but I'm in a public
place. That is the reality of today, and we appreciate you doing that for us and everyone around you. So turning it over to you. Thank you, Dr. Emily.
Thank you. I am trying to get to my update. Sorry. Just not what I think. Somehow I can't get back to my computer. Let me give this a shot here. There we go. Okay, so sorry. Am I still there and you can hear me?
We can.
Okay, perfect. So first of all, thank you. And I'm sorry I was like doing two things at once, but I can make that flip. The first thing I would say is 2 weeks ago, I think I ended my talk with asking everybody to get their flu shots. I can't see all of you right now, but I hope everybody is raising their hands to say that they got their flu shots and they got their loved ones vaccinated. What I would remind everybody, I call it the cocoon of love. We all need to get our flu shots now, and we need to make sure those who love us and are around us get important. If anybody wants any messages or tools encouraging people specifically with disabilities to get flu shots, please let Wendy know. I just finished recording a PSA maybe 5 minutes ago for that. And I think it's a very important thing for all of us to promote and to do this year. The COCA call on recommendations for influenza prevention treatment in children and update for pediatric providers is available at the website, www.emergency.cdc.gov/COCA. I actually listened to it and it was really well done. Wanted to let you know from a funding perspective, we are now open for applications for advancing population-based surveillance of birth defects. And I'm not going to read the RFA number, but the application period closes December 8th, 2020. And again, if you want more information, I'm sure Wendy would be glad to share that with you. And some general news from the response. October 15th was National Hand Washing Day. I did not spend the whole day hand washing, but I did sing happy birthday a number of times as I washed my hands to remind myself to not get lazy and do it well. And it's important for all of us to remember how important this is, not just now, but for the future, so we can prevent future pandemics. Halloween is almost here. There is some information on the website, trick-or-treating and other Halloween activities. If you're trying to figure out how to do it safely as possible, please look there. And it's nice to be able to say to friends and loved ones, here are the CDC recommendations for Halloween. Next Monday's partner update is Healthy Happy Holidays, Fall Travel, and Gathering Guidance. It's Monday from 2 to 3, and you can register online. Again, something that I think all of us, not only in our day jobs, but also in our home life, need to think about how do we do things safely. And I'd like to highlight a resource, the Science Updates page. The CDC has added a Science Updates page that offers brief summaries of new COVID-19 related topics. They're coming out every Tuesday and Friday. They are convenient summaries of the big papers. As for any of us, it could be a full-time job just to have to read and collate what's going on. And so this is something that we have internally that I use frequently that now is available to all of you. Many of you may have heard in the news over the last 24 hours, the MMWR article on the number of excess deaths associated with COVID-19 by age and race and ethnicity in the United States. And that was looking from January 26th to October 3rd. This paper really looked at health disparities. Historical data gives us an estimate of the number of people we would expect to die at a place and time. So imagine if this had been a normal January 26th to October 3rd, how many people would have died in that time period, looking back over time with trends. Expected. So the CDC estimates that 299,028 more people died than expected when compared to the typical baseline number of deaths that would have been expected to occur over this period in the United States. 2/3 of those excess deaths during the analysis period were attributed to COVID-19. The remaining third were attributed to other causes of death. While a greater number of excess deaths from July 26th through October 3rd occurred among older adults, so people between 75 and 84, the average percent change in deaths compared with previous years was largest, and this is what's really important. So the numbers may not be the biggest, but the percent change was largest for adults 25 to 44 years, and that was a 26.5% increase. Racial and ethnic minority groups experienced disproportionately higher percent increases in deaths during the 2020 period relative to average numbers they looked at from 2015 to 2019, compared with white people, for whom deaths were 11.9% above average. The average percent increase over this period was largest for Hispanic and Latino people at an appalling 53.6%. Deaths were 28.9% above average for American Indian and Alaska Native people, 32.9% above average for Black or African American people, and 34.6% above average for those of other or unknown race or ethnicity, and 36.6% above average for Asian. And I would remind you, after hearing all those numbers, go back to that one who for white people, deaths were 11.9% above average. Pregnancy and birth outcomes. In the next month, CDC and jurisdictional partners anticipate publishing an MMWR report on information on birth and infant outcomes related to COVID-19 during pregnancy that was collected through the Surveillance for Emerging Threats to Mothers and Babies network. As you all may remember, this is a network that was set up to first monitor moms and babies with Zika. This will be the first analysis of COVID-19 SETNet data, so it will be a thorough analysis. Since June, we've been reporting data on pregnant women with COVID-19 submitted by jurisdictions through CDC's case report form on a website that is updated weekly, I'm sorry. As of October 20th, 27,566 pregnant women have been reported who have COVID, and the web page also provides information by age, race, ethnicity, and severity of illness. So that SETNet report will have 50 variables, so a lot more information than we're getting from the case reports. Lastly, the Partnership Town Hall on Considerations for Institutes of Higher Education from last Monday is available online. I'd like to say happy early Halloween. I most likely will be heading to the response next month. So while my spirit will be with you, I will be trying to help moms and children as we tackle COVID. So with that, I say happy early Halloween. If you didn't get your flu shot, please make sure you've gotten it before I come back, because I'll just call off everybody's name. So thank you, all of you, and I will turn it back over to you, Amy.
Great, thanks. And thanks for bearing with us and improvising while we have few technical difficulties. I think we've got them settled. I am proud to say people in my household have gotten our flu shots. Oops, and I have a visitor.
Oh, good. Can we see the visitor?
Sure.
The whole day the whole day better. Hello.
Liat.
Hi, beautiful.
And we were just talking about the importance of getting flu shots. Did you get your flu shot? Remember?
Yeah. Yay.
All right. Well, thanks so much. And now I will back up the slides again and turn it over to Laura Kavanaugh. So sorry, everyone. We're going to go on a little ride back in time here. And Laura, just let me know when you'd like me to advance the slides.
Thank you, Amy. So thank you, Karen, for being so gracious and moving around as we got technology figured out. I just have a few updates from the Maternal and Child Health Bureau today, and then I'm actually going to turn it over to Dr. Michael Kogan, who also has some additional information to share with you. First slide, please. Or next slide, please. For the first quarter, allocations of funding for the MCH block grant are in the middle of being processed. I've signed them myself, so can attest that they are wending their way to you. This goes through this continuing resolution period of December 11th, so you should expect those shortly. Also, for those states that completed MCH needs assessment updates, that lifts the conditions on funding as well. And that we're very happy to report for all of the needs assessments also. Next slide, please. Thank you. We sponsored a Children and Youth with Special Health Needs Summit, and there are a number of items in follow-up to that summit that we want to make sure you are aware of. We are seeking public input on a blueprint for change, guiding principles for advancing the system of services for children and youth with special health care needs and their families. This is going to be available for your input through the end of the day on November the 30th. So please go to the site indicated here and provide your input. We really would like to hear. Next slide, please. One resource I want to make sure that you are aware of, our National Center for Fatality Review and Prevention has developed a review guide for child death reviews in COVID-19. The URL is provided here for your reference. Also in 2021, in partnership with the Children's Safety Network, the center is going to be releasing a number of technical assistance webinars for Title V staff on the topics of adolescent mental health, safe sleep, smoking, and pregnancy. Next slide, please. It is now my great pleasure to introduce Dr. Michael Kogan. He's our director of the Office of Epidemiology and Research here at the Maternal and Child Health Bureau. Take it away, Michael.
Oh, thank you, Laura. And let me start my video. Great. Could you take it back one? The slides back. Great. So hello, AMCHP. I'm going to talk to you about a meeting that's coming up next week, and that's Child Health Services Research in light of COVID-19. It's a listening session. It's going to take place from 1 to 5 Eastern Time next Thursday. So next slide, please. Probably all of you are aware of this in your jobs and capacities, or could guess this at least, that the pandemic has significantly altered how we deliver health services to children. I mean, data is starting to come in that you can guess that fewer children are receiving immunizations on schedule. The number of visits by telemedicine has increased exponentially. And for kids who are not getting immunizations from their pediatricians, they may be getting them at other places like pharmacies. And in addition, how we get services and the barriers to get care, the disparities have been exacerbated by the pandemic, as have other disparities. And so, next slide, please. And so we realized it's important to get people together to talk about what are next steps and what we can do. And so we are holding this meeting with two other agencies. We're hosting this meeting with two other agencies who also have a huge investment in Health and Human Development and the Agency for Healthcare Quality and Research. The participants in the meeting will be representatives from federal agencies, foundations, researchers, and journal editors. Next slide, please. So we are looking to hear ideas about how to advance our understanding of the effects of COVID-19 on health services for children and families. And we know things are changing. What are the research gaps? What are some common data elements that we're going to need to really understand the changes, even as we're in the midst of the pandemic, and what changes might still be occurring as the pandemic fades? And we will be looking for potential collaborations on topic areas and looking at available emerging data sources and developing common data elements. There will be 5 plenaries. The first will be by Lisa Simpson, who's the head of Academy Health. She'll be looking at the overall field of health services research in children. Next will be Lynn Olson from the American Academy of Pediatrics. They've been collecting data on a regular basis from pediatricians across the country to get real-time data on what some of the changes are. We'll have Stephen Blumberg from CDC, National Center for Health Statistics, talking about data from the Health Interview Survey, which got emergency authorization to include COVID-19 questions last summer, as well as other data sources. We'll have Tina Chang talking about disparities that have already become apparent, and Neil Halfon, who organized a meeting of some of our research networks to talk about overall MCH and COVID-19. And then there'll be breakout groups in addition. Next slide, please. The reason I'm telling you this is that this meeting will be live streamed to anybody who wants to listen in. And I will be sending out an announcement to this group, as well as we will all be blasting to many other groups. The information should be later today or tomorrow morning. And so I hope you can listen in to this session. Thank you very much.
Great. Thank you so much. So that is actually the end of our scheduled presentations today. So we can stop now if there are any questions from otherwise, we did have a question for you all. And that is, we'd asked last time about the frequency of the AMCHP COVID town hall / policy calls. Should we keep them bi-weekly? Should we move them to monthly? Thank you to those of you who responded to the survey afterwards. But we didn't have that many people respond, and it was split 50-50. So in order to get a more representative sample of answers, would you please fill out the poll that we have put up right now? So continue them, as bi-weekly, move to making them monthly, or maybe you just don't care. We're happy to have you join us as often as not. And again, we are happy either way. We just want to make sure that we are serving your interests as our members. And we've been so appreciative of our partners for MCHP and CDC and some other guests that we've had who have joined us week after week. But if you could just go ahead and submit your answer. I will click. I don't have a strong opinion as to maybe not skew things too much, but and Jess, is there a way to show the results?
Yes, I can show them. Oh, sorry about that. We have 45 people. I'm just going to give it another second, and then I can end the polling.
Wonderful.
Meanwhile,
Question in the chat from Kate Wilcox. Is there a link to the listening session that Michael was talking about?
We will be sending that out quite soon.
Thanks. And Dr. Remley.
I wanted to tell Marina, Chabot, who raised her hand to say she got her flu shot. Thank you.
Great. Okay, so once again, we have kind of even split. Well, Jess, I'm calling on you again just to record this because I've got too many windows up right now. And Beth points out with the possibility of a change in leadership, there may be a need to have more frequent meetings. So we can keep them we'll keep them every 2 weeks for now. But then we'll think about, if we want to do a shift, because as Beth is pointing out, our next call is scheduled for November 5th, at which time we may or may not know the results of some elections. We should hopefully know the results of some of the others that will make a big difference too in terms of continued control of the Senate and House, in addition, of course, to the White House. And I also want to remind everyone that it is open enrollment season, and AMCHP does have some products that may be helpful to you. Thanks. I'm getting my so the link is at the bottom here. It will be in the slides. You can find them also on the AMCHP website, I believe. And Jess has posted it into the chat as well. So please make sure, we hope that these can be helpful to you in the outreach. We know that different states engage at different levels in outreach and enrollment efforts, but we want to make sure that you all have these wonderful resources that my colleagues on the Health Systems Transformation team have put together. So thank you for that. So that is really our agenda for today. Again, are there other questions? Thank you, Sarah, for finding these updates helpful. And also to Noel, who mentioned that we don't have to fill the whole hour, but sometimes there's just a short number of updates that we want to share. I also Kim, about the listening session that Michael was talking about, that was another question that came in. I think only panelists can see it. And Michael said that yes, that will be sent out. We can also, Michael, send it through AMCHP publications as well. This way we can make sure if there's folks who are on the call today who might not be on your list normally, hopefully they get our member briefs.
Yeah, and Amy, I'll be happy to forward the link to you.
Great. Also, another reminder that the call for proposals is open right now for the AMCHP 2021 conference. Our theme this year, someone remind me exactly what it's called so I don't mess it up. It's, there's a global theme, but we're still planning for a in-person conference. We know it's, up in the air right now. The deadline for proposals is, okay, thank you. The theme of the conference is Global Meets Local, a global approach for local outcomes. And the deadline is November 17th. So it's actually coming up quite soon. But it is obviously something that we take a lot of time to plan for. And even if we are virtual, we obviously, as we did last year, enable the proposals and the presentations to be converted to the virtual format. So please do apply. Oh, great. Just put the link for this as well. Okay. Well, our next call, November 5th, like I said. So I will echo the sentiment to celebrate safely, but make sure the kids have fun because they're missing out on a lot of other fun activities recently. Although you wouldn't know by my daughter, the flu shot was not the funnest experience she's had this year, but so I think we can pretty much call it early today. We can leave out the call for another few minutes though, if folks have any other questions for our panelists or for anyone at AMCHP. And thanks for bearing with us for the technical difficulties today. And thank you to the kind notes in the chat. Well, seeing no other questions, have a great rest of your day and we'll see you in 2 weeks.